Hi, good morning, Kennedy. My name is Monica Rusworth. I'm your invigilator for the OET speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Kennedy William.
And what is your candidate number, please?
My candidate number is 232389227.
Thank you. And you are taking this test as a doctor. Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How much time do you spend with each patient?
I, unfortunately, can't tell you the average time that I spend with a patient. I just stay with them, as long as I need to do my job and take care of them. I am conscious of the fact that there is a schedule to keep, and I try my best to limit my interactions when patients are waiting, but I also know that it's important not to rush through the steps.
What are the unique skills that differentiate you from other doctors?
I care a lot about people's lives, and I am always cautious and extra careful while treating them. I never treat a patient basing on assumptions then predict the medication. I always conduct lab tests on the patient to ensure the conditions they have, after that, predict the appropriate medications and ensure they take them accordingly.
How do you handle emergency and workload?
My patient's life comes first before anything else. Therefore, in case of an emergency, I will first deal with the patients and ensure they are fine. After that, engaging the formalities. I will inform the manager, together with the police, of what has just happened to take immediate action. I also know my duties, and I ensure no work is left untouched by the time I finish my shifts.
Are you willing to travel, in case the job demands you to do so?
In addition to saving people's lives, I also enjoy traveling. I can travel anywhere in the world, to ensure my patients get all the treatment they need and are safe. Additionally, while traveling to new hospitals, I also learn new skills.
What are the roles of a doctor?
A doctor mainly restores the lives of their patients using medicines. They examine the patients for any illness, review their medical history, diagnose the illness the patient has and give them treatment. The doctor then educates the patient on their health and well-being. They also collaborate with other doctors to improve the quality and safety of patients' care.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Good morning. I am your Dr. Kennedy William. What brings you here today?
Good morning, doctor. I am hearing a ringing sound constantly in my ears. I fear it is tinnitus.
All right. Can I confirm your full name and date of birth, please?
Certainly. My name is Monica Russworth, and my date of birth is the 17th of May 1985.
Thank you. Well, Monica, for better understanding, can you please tell me in detail about your condition?
Doctor, I am a music journalist by profession. As part of my job, I have to go to a lot of live rock concerts. 2 months back, I noticed a loud ringing in my ears and it has worsened over the past month. Initially, I thought it would go away, but it has not.
All right.
Yesterday, I felt faint, but did not lose consciousness.
I am sorry to hear that.
Doctor, I am very concerned that I may have some serious health problems. I know about tinnitus, but this seems to have come on quickly, and I am worried about fainting.
Well, thank you for your information, Monica. I can understand your worries. Please relax. From your words, I suspect the reason for hearing ringing is possibly tinnitus. Mostly, this has happened to you due to exposure to loud noise. And as you describe, you felt fainting, which is one of the main symptoms of tinnitus. I made this conclusion.
Oh, I see.
Yes, Monica, loss of equilibrium or balance is a sign of tinnitus.
But doctor, I wonder how the condition could have progressed so quickly.
Don't get so upset, Monica. Your question is thoughtful. The tinnitus could have developed without you noticing, since it happens slowly, and that too without even any evidence of symptoms. You couldn't have noticed it. As part of your profession, you are constantly exposed to loud noise. Thus the condition has progressed at a faster rate.
Okay. I am getting more anxious. What about the treatment, doctor?
Your anxiety is quite understandable. At this point in time, the best option I can do is to refer you to an ENT, that is ear, nose, and throat specialist, who will be the best person to do further assistance and management. Nevertheless, I would like to inform you to be cautious against things that could worsen your condition.
Please let me know, doctor, what I should take care of now.
I appreciate your consciousness. Definitely, Monica, I'll explain it to you. I am sorry to say that you should avoid loud noise under any circumstances. I know it will affect you professionally. However, considering your present condition, loud noise can even result in hearing loss permanently. I hope you realize the importance of it.
I hear what you said. But doctor, I cannot avoid loud noises. It is an inevitable part of my job. Being a music journalist, I have to listen to loud music. Beyond that, listening to loud music is what I like the most.
Monica, I know how important it is for you. At present, the possibility of treating tinnitus is open. Whereas, if you continue to be exposed to the loud noise, I would like to alert you that tinnitus may be impossible to cure. I strongly recommend that. It is very important to protect your ears from loud music.
I understand your words, doctor. But, how can I? It's my livelihood. Without that, how can I move forward?
Monica, I agree with most of what you are saying. But, how can we take a chance? I can imagine what you must be going through. Sometimes, we may have to compromise things for our health and future. Considering your situation, I suggest you at least try wearing earplugs. However, it is not recommended to continue with the situation for a long time. I insist you consult the ENT specialist and take the necessary steps at the earliest.
Sure, doctor. I will.
Is there anything else I need to clarify for you?
No, doctor. It's fine.
All right, I will refer to the ENT specialist. Please make a visit at the earliest. I wish you a speedy recovery.
Thank you, doctor. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.